There are many similarities between breast cancer and ovarian cancer, but unlike breast cancer, the survival rates for ovarian cancer have not greatly increased. We'll talk with a nationally acclaimed physician about the difficulties in diagnosing and treating gynecologic cancer in women and how a new pilot program is helping patients handle small obstacles during treatment. All this and more today on Time. Good morning, I'm Kai Jackson and welcome to On Time. Breast cancer and gynecologic cancers have many similarities. The risk for developing each cancer increases with age, and the mutations in genes, specifically the BRCA1 and BRCA2, increase the likelihood of getting these cancers. Unlike breast cancer, though, early detection of these cancers isn't factoring into greater survival rates, and that's unfortunate. Joining us to talk about gynecologic cancer and the new pilot program to help women who are diagnosed with this disease is Dr. Neil Rosenshine, the director of the nationally acclaimed Weinberg Center for Women's Health and Medicine and the medical director of the Gynecologic Oncology Center at Mercy Medical Center. And also Bonnie Hall. Bonnie is an ovarian cancer patient at Mercy Medical Center, and she's going to talk with us today and share her story. Welcome both of you to On Time.
Good morning.
If I can, Dr. Rosenshine, let's first get you to kind of outline what ovarian cancer is and how serious this particular cancer is.
Well, ovarian cancer is the sixth most common cancer in women, responsible for about 3% of all cancers in women. There's about 22,000 new cases that will occur in the United States this year.
You say responsible for 3%?
3%.
So it's a small percentage.
But it is a significant cancer in women. The 22,000 cases, unfortunately, are diagnosed late. 85% are late-stage disease, and that's because of a variety of reasons. The very subtle symptoms that women present with really don't bring them to the attention of the physician early enough to get early-stage disease where we know there'll be a better prognosis.
What are other gynecologic cancers?
Other gynecologic cancers are certainly cervical cancer, and we're sort of proud of the way we've addressed the issue of cervical cancer because now we have great screening. We encourage women to get pap smears annually.
And there's this new vaccine for young girls.
And now we have primary prevention, exactly. We have vaccines that can prevent cervical cancer. We also have endometrial cancer, cancer of the lining of the uterus.
All right. Interesting. Mrs. Hall, you now are fighting ovarian cancer.
Yes.
When were you diagnosed? In
2004.
Mm-hmm. How are you doing today?
Oh, I'm great. Doing good on chemo, but you have to be positive and, keep your spirits up.
Are you married?
I'm a widow.
You're a widow. Yes, bless your heart. Do you have family support?
Oh, yes, they live with me.
How important has that been, Mrs. Hall?
Oh, that's a big plus. And you have to talk about it. And then, just the doctors in the hospital, that's a big plus.
Sure.
Because Mercy's just everybody's just so compassionate and all. It's not just doctor, patient.
And that's the kind of reputation they have there. How much did you know about ovarian cancer before you were diagnosed?
Not a lot, because my family mostly had lung cancer. So we didn't know much about ovarian.
Right. And as you found out more about it and became educated yourself, how scary was it?
Well, I'm kind of a funny person. It scared me for a moment, but then I said, no, I got to go on and do what I got to do. Where some people kind of wait, and I think you have to hit it fast.
Right.
So the doctor says this, you just do it.
Dr. Rosenshine, it sounds like Mrs. Hall is a fighter, and that's the kind of spirit I imagine you need in dealing with something like this.
Well, we like to think that medicine can take you so far, but most importantly, attitude is an essential component. And Bonnie is, as you can tell, has this great positive attitude, which has kept her going and gone through multiple courses of chemotherapy. We now have better treatments, and we can certainly get people to do as well as Bonnie does for as long as she has.
Other than a pap smear, are there any routine tests women can have to check for these cancers?
Well, pap smears is good for cervical cancer, and that's one of the things I want to tell the audience. It's only good for cervical cancer.
That's it.
Unfortunately, for ovarian cancer, we don't have that particular test, either radiologic or blood test, that will bring the patient for early diagnosis.
And Mrs. Hall, you wanted to say something about that.
Well, I went for Pap tests and stuff, but they didn't know until they got in for my hysterectomy that I had the ovarian.
That was it. Is it a biopsy that you have to do for it?
Well, I think you can make the diagnosis radiologically, and you can do it through blood tests, but it unfortunately is late in the course of the disease.
And this is one of the problems with ovarian cancer.
Exactly. That's why, again, 85% have late-stage disease. We don't have mammograms, sort of a mammo-ovary test that can find that cancer early for us.
So there is not a test comparable to mammogram that would detect pelvic cancers?
No.
Yeah. This is something that science is working on.
Well, we're certainly looking at screening tests. We're looking at combination of tests, trying to tell women if they do have symptoms to come to their doctor, tell them about their symptoms, even if they think they're rather nonspecific, so that it can be addressed and hopefully an early diagnosis can be made.
What are some of the risks that increase a woman's chance of getting these cancers, Dr. Rosenstein?
That's an excellent question. The risks are certainly if you have breast cancer, you're at higher risk for ovarian cancer. If you have a family history, and that brings up the BRCA factor, you're at higher risk. So if your mother unfortunately had ovarian cancer, or a sister or maternal aunt, that increases your risk. The patient who's never been married, never been pregnant, is at higher risk.
Interesting. Mrs. Hall, what do you think are ways, and you can share your story with women and husbands and spouses and relatives out there, what are some ways that people can be proactive about this type of disease?
Well, I mean, you have to tell people. I mean, like I try to tell everyone in the family. I mean, I don't have a test for it, but still get your Pap test and stuff, because sometimes you don't know how you have the other, but that might show, you don't know.
Never know what's going to happen.
But you need to get tested for anything, really. Don't be afraid of it.
Are women who use fertility drugs at greater risk for ovarian cancer or any other gynecologic cancer?
Well, I think you bring up a great point. I think certainly we know some things can prevent ovarian cancer, and that's oral contraceptives reduce the risk of ovarian cancer. Fertility drugs have not clearly been shown to increase the risk for ovarian cancer.
What about women who take hormone replacement therapy? This is what you take typically after menopause, correct?
This is drugs after menopause. There is a slight increase in risk for women who use unopposed estrogens. I wouldn't say that should eliminate that possibility for women, though, because it's just a small risk.
Right. And Mrs. Hall, do you have any history of cancers other than lung cancer in your family? You mentioned that. None at all.
My son had lung cancer.
So this was a surprise. Do you have daughters?
Yes. I have one daughter.
And how concerned are you for your daughter and her health?
I'm very concerned, but she, you have to push them.
Yeah, interesting. So what are some of the advances that have been developed in treating some of these cancers, Dr. Rosenstein?
Well, I think one of the great advances, I think Bonnie is a great example of that, is changing ovarian cancer from an acute disease, where people used to were diagnosed early and then unfortunately died of the disease, to a chronic disease. Now we have multiple chemotherapeutic agents that can be used some are equally effective to others. So if you fail on one regimen of chemotherapy, you can move on to another regimen.
Wonderful.
So we're switching from acute disease to a chronic disease. Also with the advent of intraperitoneal chemotherapy, giving the chemotherapy directly into the abdominal pelvic cavity where the cancer originates, is another major advance for us.
All right. We're going to hold that thought. When we come back, we're going to continue talking with Dr. Rosenstein and also Mrs. Hall. We're going to talk about a new pilot program that's helping women like Bonnie Hall. Still stay with us.